From the British Houses of Parliament in London to Zomba Central Hospital in Malawi, young mothers around the world give birth to healthy children every day. They are fortunate to have got the care and antenatal medical attention they needed, but a report published in the Lancet Medical Journal claims that there is a worldwide rise in stillborn children and that not enough is being done to address the problem of stillbirths.
98% of those are estimated to be in sub-Saharan Africa, South Asia or other lower middle income countries, with 2% in high income countries. However, I don't think this takes any country off the hook. In all countries there are stillbirths that are preventable through improving women's health and the care that we give to women.
Among the developing countries, Rwanda, Cambodia, Nepal and Bangladesh are improving. Blanco says some wealthy nations, such as Iceland and the Netherlands, are producing health systems that ensure their whole population benefits from low numbers of stillbirths. But the study says the gap between the rich and the poor in some wealthy countries means that countries as a whole are making very slow progress.
There are many factors for this, but I think the disparities between the groups, and if you look at the risk for middle-class women highly educated in the US compared to the risk for minority groups, it's often up to 10 times higher in the minority groups, and those inequities need to be addressed if stillbirth is going to be reduced in the US as a nation.
30 years ago, Isabel Martin went to hospital to give birth to her daughter. All she has left now is a locket with a photograph of her baby and a lock of her hair. She was told her baby would be stillborn, and she remembers there were not enough staff, so she was left to give birth to her daughter alone with her husband. She now has a big thriving family of 6 children, but she says it doesn't fill the gap her daughter Holly left behind.
It was a sort of rush of emotion that my first baby had been delivered, but it was the worst moment of my life because I knew she wasn't alive, and it was a mixture of emotions. I know we just broke down and cried, I remember.
The report says that in industrialized countries, it has really only been in the last decade that there has been more training for midwives and doctors to provide bereavement care for women and their families who lose children in this way. Therefore, the problem is not the level of skill and knowledge available, it's accessing it. According to Blanco, it's simple things like intercepting and treating pregnant women with malaria and syphilis can reduce the number of babies who are stillborn.
So the highest rates we've estimated are in Pakistan and Nigeria, countries that have very diverse health systems, with many in the private sector accessing very high quality care, the same as women in many high income countries, many women accessing no care at all. So needing to close the gap in those. And these countries need to be intentional about how they address this, how they listen to their women and how they provide the quality care that they need so that they can have safe and healthy pregnancies when they choose to have them.
Although many countries are now collecting data on stillbirths, nothing much is being done with it. Global bodies like the UN need focused targets for investment and achievement to reduce the number of stillborn babies worldwide. Leslie Marungu, CCTV.